What we did is we looked at a very large cohort of AML patients that are older than 60 years of age. The reason that we did this is because most studies that has been published previously look at older AML patients, but the median age is often lower than the median age at diagnosis of patients, which is 68 years. So what we did is we looked at this cohort that included six patients that are 6 years of age or older, and they had a median age of 72 years, which reflects the median age at diagnosis. We looked at the NGS, so the next generation sequencing, and we also looked at foundation sequencing, and we found that there are significant differences in frequency of mutations that occur in older patients compared to patients that are slightly younger. For instance, TP53, which is a very important prognostic marker associated with treatment resistance, is very high. It's about 40%. Or 30 to 40% in our cohort, whereas other studies have shown that this is less than 10%. So I think that that's an important finding. We also found that there are other changes, differences. For instance, NPM1 is lower, and MDS-related changes are all higher than in the younger population. And one, I think it's important to know these differences because these differences are important for treatment selection, but they're also important because they tell us something about the prognosis of these older patients. So you can inform patients at time of diagnosis about their prognosis of their disease.